A new study helping to ease the fears of expecting mothers when it comes to getting the COVID-19 vaccine. Thanks so much for joining us.
HealthPartners finds that the shots do not increase the risk of miscarriages for pregnant women. Our Leah Bino joins us live from Minneapolis. And Leah, let's look at the study here. How many people did they actually look at?
Yeah, HealthPartners looked at data from 105,000 women from across 8 health systems nationwide. We talked to one mom-to-be who says it really is a confidence boost at a time already full of surprises.
2, 3, go!
Just past the halfway mark of their pregnancy, Kyle and Becca Coomer reveal they are expecting identical twin girls. Already immune compromised and pregnant in a pandemic, there's been a lot to worry about.
We waited for a little bit to try and get pregnant, and honestly, we were hopeful that COVID would be behind us.
Becca is relieved to learn of a new study by HealthPartners published Wednesday morning focusing on women in their first 20 weeks of pregnancy when miscarriages are more likely. The study looked at data from 105,000 women and compared the odds of having a miscarriage and receiving a COVID vaccine within the 28 days prior versus the pregnancy continuing on in that same time frame. They found that after adjusting for maternal age along with other risk factors, those who were vaccinated and had a miscarriage compared to those who were unvaccinated was nearly identical.
There was really no difference in the odds.
Dr. Elise Carbonda is the senior investigator at HealthPartners Institute and the lead author on the study, and points out months ago pregnant women were put in a difficult position when vaccines first became available because they were not included in the clinical trials. More recently, the CDC and other leading medical groups recommend pregnant people should get vaccinated against COVID-19.
The data was really limited. The data we're presenting today adds to a growing body of literature showing the safety of the vaccine when administered early in pregnancy and specifically for risk of miscarriage.
Becca also recently received her booster shot. Working in healthcare along with her husband, they believe the more information and protection, the better.
And I hope it encourages any and all pregnant women or those trying to conceive to get vaccinated right away.
Now, this study was conducted as part of the Vaccine Safety Data Link, which is a group of integrated health systems, including HealthPartners, which work together to monitor vaccine safety along with the CDC. We're live in Minneapolis. Leah Bino, Fox 9.